Hi, I'm here with Don and Mary Kay, and we're going to be talking about ethical decision making. Where do you believe your ethics come from?
I think we all come with our own personal ethics, but Centricare has their own mission and values, and that's really what we're based out of is kind of the Catholic philosophy, the mission and values of the hospital.
Okay. Was there a situation where you've experienced moral distress at all? Any of you?
Eating is the biggest thing for hospice.
Yeah.
At least that's what I think. Eating is people think, their loved one needs to eat. And that's always a huge thing. They're starving to death if they're not eating, even though they may have cancer or some other debilitating disease where they can't eat. I mean, they can't handle food at all. That's probably the biggest discussion that we have to have with family is about eating. We actually did years ago have a family where they insisted that the nursing home force feed someone, and that's where we ended up going to the ethics committee at the hospital.
Okay.
And the family was there, we were there, the physician was there, and then the members of the ethics committee were there. And then they go separate after our meeting and they discuss it again and then they come up with a decision. But that's the only time I remember we really had to go to the ethics committee. But I'd say eating, and that's kind of our biggest dilemma in the home is they can't starve to death.
And how do your emotions play a role in situations like that?
You have to get very good at keeping them in check. I think every person, again, comes in, every nurse has their own background, their own beliefs, their own ideals, and our job is to deal with our families and the patients, their set of ideals, so we have to put ours on the side.
Yeah, what they want.
Yeah, so sometimes that gets to be a challenge.
And it's hard
And as
because
humans,
sometimes
we do, yeah.
you've worked with these people sometimes for a year or longer. So I mean, you are really involved, you really know them, but you have to still step away and go, I'm the nurse coming in. They are on their own, we will help them, but they are the primary people that are responsible to make the decisions.
Okay.
It's not easy.
No,
Yeah.
It's much
not.
easier said than
Yes,
done.
yeah.
Okay. Do you feel any power imbalance with different perspectives among other nurses, physicians, or family at all during these ethical decision making?
I think once in a while we'll get a physician who doesn't want to order appropriate pain medication or enough pain medication to control a patient's pain.
Well, sometimes too, it gets to be just amongst the family members themselves, where if the patient isn't able to verbalize what it is that they want, there gets to be the power struggle within the family over which direction, especially if they have different ideas of where the patient's at or what course they would like to see. Then that does get to be somewhat of a kind of a power struggle over which direction they feel we need to be moving.
We really try to have advanced directives on all of our patients, so we abide by those. If they don't have one when they're admitted to hospice, our social worker helps them do that. And I think most of us also always ask the patient, if you have severe pain or symptoms, do you want to be awake and alert and have the pain, or do you want to be sedated and be pain-free? Because then going in when they get worse kind of what direction they want to be, and you see both. Some say, no, I want to be awake, I don't care how bad the pain is, and the next one goes, do whatever you need to do, I don't want to feel it. I don't care if I'm alert or not. So the biggest problem with hospice is getting the patient soon enough that you can have those discussions. A lot of the times we get them, they're
End
literally
stage,
dying in a couple of days or that day. So you never get to have those discussions. And then it gets more difficult because you're dealing with family, and one daughter wants this and one daughter wants this and one doesn't want to get involved at all, and there's all that family dynamic stuff. So if we get all referrals appropriately in the right time, things would go much smoother. We'd be able to have those discussions like we really should.
You mentioned the ethics committee. Is there any other professionals that have influenced your decision-making process?
I would say our medical director, the physicians themselves, and then ethics if we need to.
Okay. What positive qualities do you think you possess that you believe make an effective ethical decision maker?
Open-mindedness. Again, it comes to where it's not our decisions to make. We have to look at what is it that the patient or that family would want, and does it fall within the parameters of, like what you'd said, like the hospital has outlined, or if
Or
it's a
state
little outside
laws,
of that.
we can't do assisted
yes.
suicide or
Yeah.
things like that, so is it legal? The mission and values of the hospital. And I think just experience. I mean, when you first go
Yeah.
out for your first patient, I remember my first
Yeah.
one, I sent him into the hospital.
Mhm.
You know, and then later they go, why did you do that? I thought that's what the wife wanted. She said, you never told me he was dying. You told me his blood pressure was low. You told me he wasn't breathing right. You told me all this, but you didn't use the word dying. And those are things you just kind of learn. I mean, it sounds harsh, but people really need to hear the truth and in plain words that they understand.
Mhm.
Yeah, I think that plays a big part in it too. We're ethically bound to, and like we've said to patients, we know it's not easy to hear, but it's the truth. And it's important for you to know the truth and kind of where you're at.
Mhm. Any advice for us as future nurses about ethical decision making?
Listen.
Yes. And to be open-minded
Yeah.
and always know that it's our job is to advocate for our patients.
No matter what that decision
Yes.
is.
We
Yeah.
had two daughters who became very upset with me because I told them that, your dad is dying, he knows he's dying. Because they kind of, again with the they kind of wanted to pretend it wasn't happening. But, so you have to be able to be strong, take the criticism, not take it personally, but know that it's not about you. Your job is to be a voice for the patient and the families.
Very good. Well, thank you.